There are coronavirus hotspots all around the country: Detroit, Chicago, Los Angeles. But there's growing concern about what health officials in New Orleans are seeing. The death rate in the Crescent City is alarmingly high. BNC's Fred Hickman is back, and he's going to tell us what's behind this disparity. Fred?
Hi, Laverne. Yeah, COVID-19 is proving to be an especially menacing problem in New Orleans. The raw numbers don't add up with New York City, um, but the death rate in New Orleans, as far as per capita is concerned, is 3 times higher in New Orleans than it is in New York. That's a daunting process. And experts say that this whole thing could be a harbinger of very, very bad news to come, and we'll tell you why. Orleans Parish reported 115 deaths as of April 1st. That means in New Orleans, there are 29.2 coronavirus deaths per 100,000 people. New York City, on the other hand, has recorded 1,374 deaths, but just 10.8 COVID-19 deaths per 100,000 people. So, what makes the Big Easy so deadly, and why are the hospitals filling up to the brim? Doctors, public health officials, and all the available data point to the city's high levels of obesity. High levels of obesity and related ailments may make patients more vulnerable to COVID-19. According to CDC data, the New Orleans area ranks among the worst in the United States for the percentage of people with diabetes, high blood pressure, and obesity. An estimated 39% have high blood pressure, 36% are obese, and about 15% are diabetic. All three of these are above the national average. Still, healthcare professionals are stepping up to meet this challenge and continue to save lives. And here's the thing, Laverne, I got some other numbers to tell you and to share with you about. Louisiana's health department says that 97% of those killed by COVID-19 in Louisiana had a pre-existing condition, like the ones we just talked about just a second ago: diabetes, cardiovascular disease, chronic lung disease, and obesity. The problem in New Orleans is that it is a wonderful city. It's a hugging city. It's a loving city. Uh, Great food. I lived there for many years, and but the problem is the food there will kill you. It's fried. Everything's saturated. It tastes great, but it's not the greatest for you. And when you couple that with Mardi Gras and all the different festivals that go on, Essence Fest, which has been postponed, Jazz Fest, all these different festivals where people come in and then fan out. That's a problem all across the Southeast.
Yeah, it's time for them to perhaps come up with different ways, to have a healthier lifestyle.
No, it's true. I don't know how you do that, but what we have to do is what we're, practicing and preaching. I'm here at home broadcasting from my home studio, Studio 3, I guess we could call it. But we have to practice this social distancing and eating better and just taking care of ourselves. That's the main thing we can do right now.
Absolutely. All right, Fred, thanks so much.